Welcome. It's Michael Oleski of OleskiPersonalTraining.com, and today's video topic is the inner unit. It's about time you give your core some love and stop holding back your sport. But first, we must define the core. Well, if you remove your extremities, including your head, what is remaining is essentially your core. Your core serves many functions. One is looking good. Achieving a six-pack set of abs is a common goal for many. While they may stroke one's ego, there is no correlation between those abs being physically fit and being healthy, much less disease-free. I've worked with many clients that looked physically fit on the outside but were suffering on the inside with chronic joint pain, inflammation, and other uncomfortable and unwanted challenges. The following are really the true benefits of a functional core. We have protection. Your core, the abdominal muscles and rib cage, provides a protective covering or shield for your internal organs and nervous system. We also have support. Your core contains most vital organs, with the exception of your head. When functioning optimally, your organs are supported and held in place. There's also a natural movement within the abdominal cavity that helps keep the organs from adhering to each other, improves flow of materials through the organs, and maintains bowel function. We also have circulatory system. The largest artery and vein in the body lie within the core. With optimal core function and proper movement, pressure changes occur that assist the heart and muscles of the extremities to circulate blood and lymphatic fluid. Compromised core function can cause the heart to work harder. Fluids become stagnant. There's an increased likelihood of pathogenic infections, constipation, and disease, and decreased levels of energy. Last is movement. Your core is your body's foundation for movement. We are designed to move from the center outward, from the core outward. Core dysfunction causes the extremities to compensate and work harder. Living with an unstable core will facilitate extremity joint pain, spinal pain, and increased risk of injury to bone, muscle, and connective tissue due to an inability to control compression, torque, and shearing forces. Proper core function relies on a highly functional inner unit. Speaking of the inner unit, it consists of four primary muscle groups. We have the multifidus, the deep muscles running along the spine, the pelvic floor itself, the diaphragm, a large breathing muscle, and TVA, or transversus abdominis. It's the deepest of the abdominal muscles. The internal obliques and the latissimus dorsi do play a supporting role in inner unit function, but it's not their primary function. The primary job of the inner unit is to create a stable foundational base for the extremities to move by securely attaching the rib cage to the pelvis via the spine. Prior to the movement of the head or any limb, the body must stabilize itself. A functional inner unit can turn on or engage in about 30 milliseconds before arm movement and 110 milliseconds before leg movement. Regardless of the direction or speed of motion, this engagement has to take place, and take place subconsciously to minimize the risk of injury, especially to the lumbar spine. Once the body senses the amount of load and or the forces being applied, it will adjust the tension as needed. Now, what about these support belts? When many individuals think of increasing low back stability, they think of the traditional weightlifter belt or those black contraptions worn at many local garden and building supply stores. But there exists a problem. These solutions don't work, and it may in fact increase the risk of injury. The idea behind these protective belts is that you wrap them around your midsection, cinch it up real tight, and then you're on your way to move things, often heavy things. But here's the problem. If you cinch the belt tight and or keep it cinched up for too long, you restrict breathing. A lack of oxygen is bad for many, hopefully obvious reasons. Now, most people brace by pressing outward with the abdominal wall against the belt. This is the opposite of what you should do. Pushing out turns off the deep abdominal muscles. A tightened belt will immobilize or restrict spinal movement, especially in the upper lumbar region. Now, this restriction is one reason for the elevated risk of injury to the L5S1 joint. When you restrict one joint, another joint above or below has to make up for that motion. Relying on a belt means less reliance on your actual muscular system. When you attempt to perform a similar activity without the belt, the body often cannot compensate, and this can lead to injury. So let's consider how the inner unit is designed to act as a natural support belt. The TVA functions in a manner similar to a corset. It wraps around the abdominals, attaching to the bony prominences of the lumbar spine via a large sheet of connective tissue, the thoracolumbar fascia. It also attaches to the bottom of the rib cage and upper rim of the pelvis. When TVA contracts, the thoracolumbar fascia tightens, drawing the abdominal wall inward from the front and sides towards the spine, increasing spinal stability. There is also an increase in intra-abdominal pressure. This increase in pressure pushes down against the pelvic floor, up against the diaphragm. This vertical pressure decompresses the lumbar spine. It literally increases space between the vertebrae, releasing pressure on the vertebral discs and nerves. Additional benefits of this intra-abdominal pressure includes improving posture by propping up the rib cage, reducing slouching, and reduces the stress on the shoulder girdle and cervical spine. The increased pelvic floor function can greatly reduce incontinence issues. If I recall correctly, roughly 40% of female runners by age 40 have some degree of bladder control issues when running. Running itself does not appear to improve core function on its own. In fact, it may actually make things worse. Now, as with a girdle, the deep abdominal wall, or TVA, is the primary structure that allows for a flat stomach. The dreaded paunch belly is merely a side effect of a dysfunctional abdominal wall. If left unchecked, it can develop into a severe condition, visceraptosis. This is more common in females. In this condition, the abdominal organs, colon, intestines, liver, and stomach, are no longer properly supported and they droop downward. This puts additional pressure on the underlying uterus and bladder. The result can include constipation, causing the transverse colon to become enlarged and heavy with fecal matter, increases in menstrual pain, incontinence issues, even prostate-related problems, just to name a few. Now let's consider some common blocking factors which impede optimal core function. First, we have trauma. Surgical procedures, including herniation repair, gallbladder or appendix surgery, will alter muscle function. Anytime you cut into or through a muscle, harm can occur. The most common damaging procedure is the C-section, when the infant is not able to pass through the pelvic canal for any number of reasons. Regardless, consider that you are literally cutting through multiple layers of muscle, connective tissue, nerves, and fascia. Best case is that you are sewn back together properly, though this is far from guaranteed. Then you find a competent trainer or therapist that understands core function and can rehab the area while taking into account scar tissue adhesions and nerve damage. The most common visible symptom is the pooch, or distension of the abdominals just below the belly button that does not respond to any common abdominal exercises. We also have unhappy organs. Your internal organs and muscles use the same nerve fibers to communicate. When an organ is compromised or in pain, the brain cannot determine if it's the muscle or the organ that hurts. The brain only knows which segment of the spine the pain message came from. Each area of the spine is associated to specific organs or organ. The brain tells all tissues and organs on that nerve pathway to behave like they are in pain. Pain always weakens muscles, resulting in loss of tone and force generation. Now, you may be thinking I'm nuts or maybe a little off my rocker, but consider a heart attack. You don't typically feel the pain in the heart directly. Rather, the pain is on the left side of the chest. It's diffuse and in the left arm. Many women experience back pain and sometimes down their legs during their menstrual period. It's very common to suffer back pain when constipated and then find that an enema or laxative eliminates the pain almost immediately. Organs talk to muscles, muscles talk to organs. We need to learn how to listen. There's also back pain. Nerves that innervate the joints of the spine are branches of the nerves that feed the muscles around the spine. Anything causing pain in the spine can alter muscle function along with any organ or gland innervated by that nerve. There's also diet and lifestyle. Anything causing inflammation of an internal organ will cause the associated muscle innervated by that same nerve to weaken and or be unresponsive to exercise. I've personally consumed foods I've had a sensitivity to, specifically to test this. I assessed my core function using a core stabilizer. I ate the offending food. I retested the same exercise and could not maintain the same degree of core control. While this information may be different from what you've been told and led to believe, it's not science fiction, it is science fact. So what are the most common causes of organ inflammation? Well, consuming foods or fluids that you're either allergic to or intolerant or sensitive to. Sensitivities can be uncovered with a blood test. The most common food sensitivities include dairy, and it's typically pasteurized dairy and of an A1 gene designation. Eggs, especially consuming the whites. Gluten appears more problematic in modern and or GMO grains. Caffeine, salicylate, it's a defensive chemical produced by plants and also used as a preservative in processed foods and many pharmaceutical drugs. We have sulfites, found naturally in some foods, but the more harmful are the chemical forms used as a preservatives in foods, drinks, especially alcohol, and also some pharmaceutical drugs. Even fructose, which is a simple sugar. Other common food sensitivities include aspartame, MSG, food colorings, yeasts, and sugar alcohols. Essentially, there's nothing consumed that can't trigger a reaction. But if you have a reaction, you have an unresolved gut problem. If you have an unresolved gut problem, you may never achieve optimal core function. We also have inappropriate exercise, especially use of machines. Outside of rehabbing an injury or trauma or even bodybuilding, strength machines are largely a waste of time, energy, space, and money. Your nervous system is really smart, wanting to protect itself while stabilizing your spine to support movement. Your nervous system only activates the muscles in direct relationship to the demands placed upon them and joints. When you're bolted to the floor, wearing a seatbelt and supported with any number of pads, how much stabilization does your body really need? Strength machines challenge the muscles of the outer unit at best, the muscles designed to move the body. Machines result in massive recruitment of these muscles with little recruitment, relatively speaking, of the inner unit and smaller stabilizers that act upon joint control. I've seen individuals leg press 500, 800 pounds plus, but they can't perform a body weight squat to a full range of motion. Muscles gained by machines may provide a level of confidence, but it's a false confidence. This is often very obvious when you see them trying to handle a heavy power tool, a squirming child, or do even basic yard work such as gardening, much less a high-speed skilled sport. While the body has many neurological protocols to prevent injuries, an unbalanced neuromuscular system can still generate enough force in a short enough time that the nervous system cannot react quick enough. Milliseconds matter. It's much better to train with free weights, kettlebells, suspension straps, Swiss balls, and even calisthenics than use machines. And if you're not comfortable doing so, find a competent trainer or coach and hire them. Because the outer unit is visible to the eye, it tends to get all the attention, often at the expense of the inner unit. The result is that both suffer in the long run. It's not an issue of if, but when and how will it manifest. I'll break down the outer unit in a future video. For now, I encourage you to focus on the inner unit as it is foundational to your sport and any other activities you're involved in. So are athletes immune to core dysfunction? Actually, no, they're not. In fact, athletes tend to have the most dysfunction. Athletes have physically abused their bodies and worse. Often, they work through the injuries rather than properly correct, recover, and heal them. And this is a recipe for compensation, as an athletic individual often excels at compensations. They just find a way to get things done, regardless of how or the consequences. Over time, nagging aches and pains arise, often out of nowhere and without a definite cause. This is your body trying to communicate that something is wrong. Rather than uncover and address the problem, we focused more effort into masking the issue. We begin relying on complementary services, including soft tissue work, chiropractics, acupuncture, and more, just to keep us on the field. Now, I'm not saying these are bad. It's just, are you using them proactively or are you using them reactively? Consider having your core assessed. You may be amazed by not only what is found, but how much better you feel and move when corrections have been implemented. But don't be afraid to think outside the box. If your physical attempts do not match reasonable expectations, then consider that the true causal factor may be related to suboptimal diet and lifestyle choices or unhappy organ system function. But don't take my word for it. Give it a try. See how your body responds and what it has to say to you. I believe this is enough for now. So until next time, thanks for watching. I would like to finish with saying that my services, including personal training and transformational health coaching, is based in Phoenixville, Pennsylvania. It's a western suburb of Philadelphia. I work with personal training clients one-on-one at my office or in-home locally. My transformational health coaching practice can work locally one-on-one or with anyone remotely via Skype. So again, thanks for watching and have a wonderful day.